We'll start in about 1 more minute. Okay, greetings everyone. Let's go ahead and get started. Barbara, will you start us off?
Certainly. Hi, everyone. Welcome to today's webinar, Quantification of Health Commodities, Part 3. This is the third part of the 3-part webinar on How Much Supply Do I Need? A webinar series on estimating health commodity needs in emergency settings. And this part focuses on supply planning. This webinar continues the topic of quantification that started with Part 1, which covered planning for a quantification exercise and the basics of forecasting, and Part 2, which covered forecasting of kits for emergency response. We will give you information on accessing the Part 1 and Part 2 recordings at the end of this webinar in case you are not able to attend or if you want to review those contents. As always, we are very glad to have you with us, and a special welcome to anyone who is joining our webinar series for the first time. My name is Barbara Lamphere, and I'm joined by my colleague, Greg Roche, to present this webinar. Greg, can you introduce yourself to our audience?
Sure, thank you. Hello, everyone. It's nice to be with you again. I'm Greg Roche. I'm a senior technical advisor at JSI. I've been around for a little over 20 years working in various areas of supply chain management, including system design, assessment, and so on, and now including these webinars. And I've also done some work in quantification in different countries. Nice to be with you. Barbara?
Thanks, Greg. I'm Barbara Lamphere, and I'm also a senior technical advisor at JSI, and I work in organizational development and capacity building in supply chain. I've been doing this for a little bit more than 30 years in a variety of technical areas and in many geographies, including Africa, Asia, and the Middle East. And again, we are happy to have you join us. As we get started, we invite everyone to introduce him or herself to others using the chat function in Zoom. And I see that many of you have already started doing that. Thank you. And we should have time at the end of the presentation for questions. And if you have a question, please use the Q&A button found at the bottom of our screen to submit your question. Please don't use the chat button for your questions.
Thanks, Barbara. Excuse me. So let's start with a quick introduction and an overview. We first, of course, want to remind you of the USAID Bureau for Humanitarian Assistance, BHA, capacity building program through which this webinar is made possible. The program is being implemented by JSI Research and Training Institute, Incorporated. The overall aim and the objectives of the program are shown here. Let's review the objectives for this webinar. After we do a very quick review of the Part 1 and Part 2 webinars, we will describe the steps in supply planning and the use of the supply planning for informing financing and procurement decisions. Explain the importance and process for routine pipeline monitoring and updating of the quantification. Explain how lead times factor into supply planning and the importance of monitoring lead times. Describe some of the challenges that are related to quantification in general. and identify tools that can be used in a quantification exercise. And of course, we'll also provide instructions for the post-webinar game that's ongoing from the previous webinars.
So let's do a quick review of the part 1 and part 2 webinars. If you attended those webinars, this will be a refresher. If you were not able to attend the webinars, then this will give you a quick summary of what we covered to set the stage for today's technical content. As we had said, we will also be sharing the recording information for those first 2 webinars, so you can catch up fully on those later. Here's a reminder of the topics that we covered during the part 1 webinar on quantification, which focused on planning for quantification and on forecasting. And here's a reminder of what we did during the part 2 webinar, which focused on the forecasting of kits. Let's do a quick highlight of some of the contents of parts 1 and 2 to prepare ourselves and to set the context for this webinar on supply planning. First, we defined quantification as shown here. So I'm going to give you a few minutes to read the definition of quantification. And we presented this overall process for quantification. We looked at in detail at the preparation phase and the forecasting phase. So that's what we did in the first 2 webinars. So take a look at this diagram. And during this webinar today, we're going to focus on that 3rd phase, the supply planning phase of this process, as well as the other related topics that were presented in the objectives that Greg just reviewed with you. So this is our process in the steps for quantification. We identified the supply plan as the final output of the quantification. And the supply plan includes elements shown here. So you can review these for a minute here. The supply plan usually includes the total commodity requirements, the total commodity costs, funding sources and funding commitments for each product, and a planned delivery schedule that will ensure continuous supply and make sure that we are maintaining the system max and min levels if there are those set. During the first webinar, we presented and discussed these steps that make up the first phase, the preparation steps of the quantification, describing the program, looking at the scope and purpose of the quantification, and collecting the required data.
We talked about the data that we need for forecasting and for supply planning. We also discussed where we can get these data and some of the challenges that we might have related to data. We discussed in some detail these steps in the forecasting stage of our quantification. We emphasized that the final forecast will be the predicted quantities of products to be dispensed or used during each year of the forecast period. During the part 2 webinar, we looked at some of the different types of kits, examples of which are shown here. We also discussed how we will likely be doing our forecasts for kits based on how the kits are designed for a population, for a specific target population, or for an expected number of cases or treatments or procedures. We also looked at a variety of challenges that we might face when forecasting for kits. Those are listed here, and you can get the details from the webinar recording. So now let's turn our attention to the topic of supply planning, which is the main topic of this part 3 webinar on quantification. Remember that supply planning is the phase that follows the forecasting phase and that we use the final forecast for each product as our initial input into the supply planning stage.
So here's the basic definition of supply planning that we can adopt for our purposes. We will consider supply planning to be applying, as Greg said, those forecasted requirements to our current system pipeline, taking into account in the current stock on hand, any amounts on order, and supplier lead time and costs. So with that in mind, the purpose of our supply plan will be to determine when it is best to receive shipments and orders, to ensure that there are adequate stock levels of supplies in the pipeline or in the program, and to prevent overstocking and stockouts. Essentially, the supply plan will help us answer this critical question: how much of each product should arrive and at what specific time? Let's come back again to think about the differences between supply planning and forecasting. Recall that we defined the forecast as the estimated consumption for a specific time period. So, for example, we have a forecast consumption of 1 million condoms for the year. The question is, do we need to procure 1 million condoms? So let's ask you in a poll question. Let's do a quick poll. Let's launch the poll. And I'm going to ask you the question. We have a forecast of 1 million condoms for the upcoming year. Will we automatically procure 1 million condoms? Yes or no? Just give you a few more seconds to respond. Okay, almost got everybody responding. I think our responses are slowing down. Just 10 more seconds and we'll reveal the results. Okay, let's see the results of our poll here. So let's see. Well, the majority of you, 91% of you, said no, and you are right. If we estimated our consumption of 1 million condoms for the coming year, we would not automatically procure 1 million condoms. So the answer is no. So let's dive into this a little bit more. Okay, so for example, if you have in stock 400,000 and you already have 100,000 on order, but it have not yet been received, then we don't have to purchase those again. So we would subtract those 500,000 from the million. All right. Further, we need to examine our system, our logistics system, our pipeline, and our existing stock, and find that when we do so, we find that we need a buffer stock of 150,000, and we have 50,000 that we suspect will expire before they can be distributed and used. So we need to add those to our procurement quantity. Thus, so we're going to add those to the procurement quantity. Thus, we calculate the actual procurement quantity needed is 700,000. If we ordered 700,000 more than that, and we rely on our 500,000 that are stock in order, then we have enough to meet our 1 million condom demand. And we have enough buffer stock for our system, and we'll be able to replace any product that does expire. So we need to take into account these other factors of what's on the stock in hand, on order, and what are our buffer stock and expected needs for the pipeline, taking into account any of those possible losses as well. So we also want to emphasize the differences between supply planning and routine ordering. As shown here, for example, routine ordering is at the lower levels in the system. It's moving commodities already procured and received down the system to the service delivery points. There is typically a shorter order interval and shorter lead times. And routine ordering is based on recent past consumption. On the other hand, supply planning is for the higher levels, certainly at the national program level, but possibly at the subnational level, if any of the lower levels are responsible for procuring their own products. Supply planning relates to procuring for the program and not individual facilities. There are usually longer lead times and longer order intervals for supply planning, and the supply plans are based on future expected consumption, not recent past. Now let's think about the steps involved in supply planning. We have 5 main steps listed here: organize and analyze supply planning data, build supply planning assumptions, estimate total commodity requirements and costs, develop the supply plan, and compare funding available to the total commodity costs. Let's look at each step in more detail. Our first step in supply planning is to organize and analyze and adjust data, just as we did with our forecast data and described in the previous webinar. Here is a reminder of the data that we need for supply planning. We saw some of these during the part 1 webinar and on our little example we just did, but this list goes into more detail. Remember too that we start collecting this data during the preparation step for the overall quantification exercise. So take a moment and review this list of data requirements. The second step in the supply planning process is to build our assumptions. So just as we did with forecasting, we will have to make some assumptions about elements of our supply plan. And here are some guidelines related to some of those assumptions. For example, if certain data are not available, then, for example, if we don't have complete stock on hand data, then we would have to make and agree on certain assumptions related to that missing data. And if we don't have a formal max-min stock level system in place, then we need to make assumptions about how much stock facilities at each level will need to hold. Here are some examples of other assumptions that might be made during supply planning. Other example assumptions might be, if we have products already on order, we're assuming that those products will arrive as scheduled. And if we count our entire stock on hand in our calculations, we're assuming that we will not have any significant losses from among that stock. The third step in the supply planning process is to calculate our total product requirements and costs. We will start by calculating our total product requirements. So as we see here, to determine this, our total requirements, we need to have enough stock to meet our forecasted consumption, and we need enough stock to ensure that the in-country pipeline has adequate stock levels to maintain a continuous supply to the service delivery points or community health workers. So let's just look at a practical example, but we will review it again. To get our total commodity requirements for the forecast period, first we need to meet the need of the forecasted consumption. This is like this condom example I did with you a few minutes ago. We have to add in the additional quantity needed to cover procurement and supplier lead times, buffer stock, and any anticipated product expiry or loss. And then we need to subtract the stock on hand and any quantities we already have on order, assuming that those orders will arrive as scheduled. Once we have calculated our total product requirements, we can then calculate the related costs. As shown here, we can see that the costs are not limited, as we all know, to product costs alone, but we need to take into consideration shipping costs and insurance costs during shipment and custom clearance and any other costs. In any case, by the end of this step, we will have a cost estimate of the funding needed to purchase and receive products that will enable us to meet the expected demand for the product as forecasted and for our pipeline considerations. In other words, the cost for our total product requirements.
The fourth step in supply planning is to develop the supply plan. And here is some guidance that we want to keep in mind related to the supply plan. The first thing we want to remember is that we want our product shipments to arrive in country around the time that our national stock level reaches its minimum. This is because we do not want to wait until we expect a stock out to receive our products. The quantity that you receive should bring your stock level up to the established maximum stock level. This means the total of the maximum stock levels at each level in the system. Central level storage, regional level if you have regions storing products, districts if you have districts storing products, and of course the service delivery points as well. If your program does not use a maximum system, then you still want the quantity received to enable you to reach some total quantity that you want to have at the time you receive the products. If we are using maximum minimum stock levels, remember that our stock levels are defined in months of stock on hand. And here's the general formula for calculating months of stock on hand. Now, with the formula applied using our actual logistics data, we calculate months of stock by dividing our stock on hand by our average monthly consumption. Remember that for supply planning, we are looking at months of stock in the country as a whole. So our stock on hand would be stock on hand at all levels and all facilities in the country. And our AMC, our average monthly consumption, would be for all service delivery points in the country. Let's look at a practical example of supply planning. For the program in this country, the national maximum stock level is 14 months of stock, and the minimum is 6 months of stock. And remember again that the national maximum is the sum of the maximum at each level in the system. The national minimum is the sum of minimum stock levels at each level in the system. Let's suppose that today is January 30th, 2019. Our previous quantification would have planned the May 2019 and September 2019 shipments that we see highlighted here. So now for us in January, we are looking beyond those dates. Notice that the data in the consumption column is our forecasted annual consumption divided by 12. In reality, of course, consumption will go up and down throughout the year, but at least this number gives us a picture of what average consumption would look like and help us to plan shipments to maintain stock levels between the maximum and minimum levels. Also notice that we forecasted that consumption would increase in 2020. Keep in mind that the months of stock calculations when forecasting and supply planning are based on an average monthly consumption that is calculated using the current month and the next 2 future months, as Barbara mentioned earlier, adding expected consumption for those 3 months and dividing by 3. Note that the 2 planned shipments are arriving when the national stock status is about to go below the national minimum of 6 months. If those shipments would not arrive, then the months of stock on hand would go below 6. And remember that those shipments would have had to be planned so that they arrive in those months. We'll see this later. And this would be based on the expected lead times at the time of the previous quantification.
Well, Greg, there's something interesting here, which I don't quite understand, but I see the quantities ordered, they didn't bring in the stock levels up to maximum, but we said that we should bring our stock levels up to maximum. So what could be happening?
Yeah, exactly, Barbara. That's a great observation. Actually, in this case, we can imagine that we don't know the reason why they did not plan for enough to get to the maximum, although really they should have. Perhaps there was not enough money, or perhaps there wasn't enough central level storage space. Perhaps they were expecting a global shortage of the product at the manufacturer, or perhaps they knew that there was going to be problems with their supplier, or maybe with the wholesaler. But in any case, you're right. We do want to plan our shipments to reach maximum. They didn't do such a great job last time for whatever reason, but we will do that with the next shipment that we are going to plan now. So have a look at the supply plan, everyone who's attending, and notice the months of stock and the consumption. And so here's a question for you now. We want our next shipment to get us to the maximum, and we want to make sure we receive the shipment in time. So for you, based on the information that we see here, when do you think the next shipment should be scheduled to arrive? Please take a minute and think about your answer. When should we have the next shipment arrive? All right, did you say December 2019? That is the month we would normally be going below our minimum stock level in the country. So that is when we should receive our shipment. And if we receive 1 million, as we're proposing here, we will get to our maximum of 14. In fact, we'll be slightly over. That can be okay. Sometimes the pack sizes or the minimum shipping quantities from our suppliers will result in going a little over maximum, but we're not going to consider that that's going to be a serious problem. We can already see that the next month we're going to go back down again below our maximum already. If we look at this example graphically using the information that we had for the already planned shipments, we again see that the last time they did not plan for their shipments adequately, again, for whatever reason. The quantities they planned to receive in May and in September were not enough to bring them to the maximum stock level of 14 months. If they had been able to plan their shipments correctly, or if we had done it the last time, then the supply plan would probably have looked more like this, with the stock levels always varying between the maximum and the minimum. Keep in mind again that this is the national stock on hand, the total stock on hand at all levels in the system.
So coming back now to the overall process, remember that our proposed supply plan is developed to meet our needs as we originally determined, including the forecasted need and whatever our pipeline needs are. But once we do all that, what if our funds are not sufficient to purchase all the products as included in our supply plan? What do we do? So if funds are not sufficient, then the program has some options. It can must mobilize resources until enough funding is available, or the program must adjust the supply planning or forecasting assumptions to buy fewer products with the funding available. Once the required resources are mobilized, the process can then move into the procurement phase. Keep in mind that if you are adjusting the supply planning or forecasting and assumptions, this doesn't mean randomly reducing forecasted consumption or the max min levels. If we adjust the safety stock in the system downwards, then we are accepting more risk of possible stock out. And if we adjust the forecast numbers downward, then we are accepting that we will cover a smaller target population. So also keep in mind that in a humanitarian context, this is still the same process. Quantification and pipeline monitoring are still important, even in the short-term one-year project. Also, the person who does the quantification and pipeline monitoring in a humanitarian setting will vary by organization, but it's often the field health logistician. As a reminder, the outputs of the quantification, specifically the total requirements and the cost and the supply plan, these are used to inform decisions and to take actions as listed here. So take a moment and read this slide. We have obviously program planning and budgeting decisions, mobilization and allocation of funding for procurement, coordination of multiple sources of funding. Oftentimes we do have multiple sources of funding. Those will have to be coordinated to ensure we can cover the total commodity costs. Informing procurement actions on which products to procure, how much to procure, and when to procure. So that's how we use that information to help us with our procurement. And then we will adjust the timing, as we saw in the exercise with Greg, based on when is it most appropriate to ensure continuous supply and avoid stockouts and overstocks. I just want to say one thing, like, let's keep in mind that our job is not finished. We just can't go home after we finish our supply plan and say that and wait until next year to look at it again. So there are more steps to keep going, and I'll ask Greg to speak about those now.
All right, thanks. And I apologize for the backtracking. I was a little bit off on that one. But yeah, you're right, Barbara. We don't just go home after the end of this exercise. We do need to do routine monitoring to verify that what we had assumed and what we had planned based on those assumptions actually comes to pass. If not, then we would need to adjust along the way. And let's talk about this in a little bit more detail now. So here are some of the specific things that will make up the activities in our routine monitoring: tracking the shipments, keeping updated with our actual consumption compared to our forecasted consumption, tracking any losses or adjustments, adjusting things as they go along if shipments are delayed or if maybe they come early, and overall monitoring the stock status in our system. Here's an example of a report that could help us to monitor stock status. Over time, we would update our database and our records with the different elements, such as the products received, any significant adjustments, updating our monthly consumption as actual data become available, and so forth. Based on that data, the number that we're focused on is the months of stock to verify that our stock levels are remaining between our minimum and our maximum. If not, then we might have to take some kind of action. If our stock levels are going down too fast and we risk getting to our minimum or below, we may need to place an emergency order for an emergency shipment, or we might have to move up a receipt if our stocks are getting low, as I said. If our stocks are not moving as quickly as we had thought, maybe the consumption is slower than predicted, then we might have to delay a shipment so we don't get too high above our maximum. Another thing that we'll want to monitor is the dates we actually receive our shipments compared to when we expected to receive those shipments. Remember that we plan our shipments so that we receive products around the time that we would reach our national level minimum stock level. If a shipment arrives later than planned, we could end up below our minimum stock level. If the shipment is very late, we could be at risk of a stock out, either at the central level or even throughout the country, depending how late that shipment is. And of course, we want to avoid either of these happening. So to avoid this risk of any stock out, the element that we will monitor now is lead time.
So remember that lead time is that time interval between when an order is placed and when products are received and available for use. Also remember that there are several steps that are included in the overall lead time. So we want to monitor each of these steps separately. This may help us help improve the process moving forward if we understand the lead time variations. We want to keep track of the times between when the shipment is planned and when the order is placed, when the order is placed and when the products are shipped, when the products are shipped and when the products arrive at the port of entry, and then when products arrive at the port of entry, and then how long it takes for them to be ready for use, which in this case means that products have been received at the first storage point in the country, they've been processed, they've been inspected, passed any quality assurance that they might need and put into storage, and then they are ready to be issued out of the warehouse. So going back to our previous example event, let's look at lead time planning in a bit more detail. This is the pipeline and planning and monitoring report we saw previously. And we will focus on the shipment that arrived in December of 2015. As part of our monitoring, we would want to track the shipments and the time it takes for each part of the lead time process so that we can use that information to improve the lead time components in the future. So, for example, this shipment, which was to arrive in December, we would have had to have placed it back in February. After securing approvals and allocation of funds and getting shipper supplier bids and doing the contracting, we may have actually placed the order in May. So there are steps that take place between the time when you plan the order during the quantification and supply planning process and when you actually place the order. Then the next part, the shipper may have to be, is shipping the product, and in this case, may have been able to ship that order in August. And then we knew again that it arrived in December. So there are different components of this lead time that we should be tracking so that we know how to improve the process. The total lead time for this fictitious order was 10 months, and it may be longer if after the receipt there was a significant time for customs clearance and quality testing before it was available for use. Keep in mind that our overall lead time might still coincide with our planned overall lead time. As seen as this example, however, there was a variance in 2 of the individual steps: ordering to ship, which happened faster than we planned, and arrival to available for use, which took more time than we thought. Even though the overall lead time was the same, we want to be aware of these details so that we can improve our planning in the future. It's not enough just to say, great, our overall lead time prediction was correct. We also, in our monitoring, we want to track our forecast accuracy. We want to see how close our forecasted consumption was to our actual consumption. If our forecasts are too far off, then next time we want to have a better look at the data that we use to produce those forecasts and see if we can improve our forecasting methodology as well as the data we're using for those forecasts.
Thanks, Barbara. Let's end our technical discussion of quantification by looking at some challenges that we might face. We have some that are listed here. And actually, related to these challenges, we're not going to have time to talk about each one in detail, but let's ask our participants. We would be interested to know what are some of these challenges that you face in the quantification process. So let me launch another poll. And we're going to ask you to indicate and choose as many as you face, as many of these problems that crop up in your system or in your work. Which of these have you faced when doing quantification? It could be related to limited drug budgets, estimates based on budget allocations and not actual forecasts, sourcing restrictions, lack of information, weak or no LMIS, trying to coordinate with other partners, trying to transition from the use of kits. We talked about that last time in our kit discussion. limited human resource capacity, or maybe other problems, other issues or other challenges that you might face. Take another moment to answer for yourself, for your program, and then we'll take a look at some of the answers. Another few seconds. It looks like maybe about half of the people have put at least one answer. Okay, they're slowing down a bit. Take a final 10 seconds. We'll look at the results. All right, so I've just ended the poll. Thanks to everyone who was able to participate or to put your answers. And so what we see is we have the number one issue that people have identified is lack of information or poor supply chain visibility. And really that is a very, very unfortunate and a very, very serious challenge. If we don't have good data, we've seen that we need data throughout the process for forecasting and for supply planning. And so not having that data really does present a big challenge to our programs and to our process. We have weak or absent logistics management. I believe that should be information system is another top one. Limited human resource capacity, of course, is a frequent issue that countries or programs face. Limited drug budgets, certainly as well, and we can see the others. So really, and you know, it's interesting to see there is a wide variety of challenges that you're facing, and of course, if you have suggestions for facing your challenges, please go ahead and include those maybe in the chat, or you could put a comment in the Q&A. And of course, we hope that the information that we've been providing through these webinars is contributing to your ability to address some of these challenges. So thanks again, and as always, we'll wish you luck in working in your programs and working in your systems. So thanks for, so we hope that this has been useful to help you deal with or avoid some challenges in the future. So let's continue. In the earlier webinars, we shared some tools that were specifically related to forecasting. You'll have those lists again if you're looking at the recordings or linking to the shared documents that we always share after the webinars. We will also share a few tools that go towards the process or the sub-process of supply planning. So there's a few listed here. We don't have time to look at them in detail during the webinar, but you'll have this list now. You see it here on the screen, and we will share this list with you again at the end of the webinar, so you can explore those tools on your own.
So this brings us to the end of the technical content of the part 3 of the quantification webinar. I'm going to provide we will provide you more information, instructions about the webinar. I see several questions in the chat. If you can get the slides and so forth. Yes, we will be providing this at the end of the webinar. We'll give you more details at the end. But I want to remind you about the game. We have been sponsoring a game that for each of these webinars in the series. We're continuing the part 1 and part 2 games, but the purpose of these games are to help improve and to keep refreshing your knowledge of the content that we share with you in the webinars. Next slide, please. So what do you need to play the game? You need a computer, mobile phone, or any device with a stable internet connection. You need a web browser. Anything except for Opera will work well with this game, and your enthusiasm to learn. I want to point out that the website has changed for the game. So if you've previously been playing the game, you will please update using this URL, and we will give you further instructions when we send our follow-up email after the webinar, as along with these instructions with the registration code. If you've already had this registration previously, then you will continue. You will scroll down in the game and find the Estimating Health Commodity Needs and Emergency Settings game and click play to play along. And next slide. The game should look something like this. And you click play and refresh your knowledge. Next slide, please. Just a few tips. Their questions are multiple choice. And if you are playing in competition with other players, if they happen to be online at the same time, you can maximize your score by using the jackpot feature, which will add additional points. So if you click the jackpot before you submit your answer, you'll get additional points. It can double your points. If you get a wrong answer, though, you could lose your points. If you and a co-player hit the jackpot at the same time and you both get it right, the person who's faster will actually get the points. So I hope you play along. Next slide, please, and happy gaming. And to refresh your knowledge, use this game to help you improve your skills in quantification.
Great, thanks, Barbara. And we've already seen lots of participation in the game, which we're really happy with. Okay, this is the end of the webinar. So today we have described the steps in supply planning and the use of the supply plan for informing financing and procurement decisions. We've explained how lead times factor into supply planning and the importance of monitoring lead times. We've explained the importance and the process for routine pipeline monitoring and updating of the quantification. We quickly identified some tools that can be used in a quantification exercise. We described some of the challenges that are related to quantification in general, and we got your feedback on those. And we provided instructions, as Barbara just did, for the post-webinar game. And of course, we do have time for questions, as we had hoped. So let's look at some of the questions that have come in. And please remember to use the Q&A function to ask a question so that we can document these questions and then share the information with you after the webinar. So I will start at the top of the list. There's a comment. We had earlier presented some information on buffer stock, and there's a comment. I think the buffer stock should be for 3 months. So 150,000 is not enough. Certainly the buffer stock requirements will be defined by your program and by your system. So yeah, maybe you don't think that the quantity that we have there is enough. You want to have more buffer stock, and you suggested 3 months of stock. Based on the consumption, you would want to include that quantity in your supply plan. There's another comment on decentralization experiences for supply, and it was successful. We mentioned that if you're doing quantification and the lower levels are responsible for procuring, then they might be doing an actual quantification exercise at the lower levels. For cost, we need to predict even the probable inflation in the commodity price. Go ahead, Barbara.
No, I was just going to say that in a course that we've been teaching now, the challenge of inflation is quite real and large, and that yes, you do need to predict for inflation going forward if you don't have some arrangement with fixing the price in your contracts, or either any of the parts of the process for which you pay. So shipping costs, there's been a lot of inflation, particularly since the COVID pandemic, for shipping costs and other areas of the supply chain. So yes, we need to be sure to adjust, and that's another assumption that you'll make in your supply planning process and doing the total commodity costs, is making an assumption of what those costs will look like throughout the coming year. And it's important to obviously update those costs as you get better information, as you make different vendor agreements, is to update your cost estimates as well as you go along.
Okay, great. There are a couple other questions, and Barbara and I always like to share, so I'll take one and then I'll ask.
Okay.
And Barbara, I'll ask Barbara to take a look at the other two. So the one, there's a question, is the maximum stock level include the quantities from the SDP. In case we don't have data from the SDP, how do we calculate the max and min stock? That is a great question. And yes, when we talk about the maximum stock levels in months of stock, it includes all of the levels in the system. So as we said, it's the national level maximum stock. It's the central maximum plus the regional if there is, plus the district if there is a district level, plus the SDPs. If you don't have data from the SDP, for example, we can't collect enough stock on hand data from the SDPs at the time of the quantification, then we have to make some assumptions. And the assumptions that you make will be based on what you intrinsically or intuitively know about your system. I'll try to give two examples. Let's say you're doing your quantification and you're at the midpoint in the resupply cycle for the SDPs. So let's say the SDPs resupply every quarter, and you're now at the beginning or maybe in the middle of the second month of the quarter. One of your assumptions could be that the SDPs are generally stocked according to plan. So we'll estimate that among all of the SDPs, there is roughly 1 or 1.5 months of stock available at the SDP level. If you can agree on that assumption, you'll use that number. You'll look at your average monthly consumption and calculate what would 1 month of stock be, what would 1.5 months of stock be at the service delivery points, and you assume that that's about what they have in stock. A different assumption might be, no matter when you are in the resupply process for the different levels, maybe one of your assumptions is that, well, we know we have supply issues for certain products, and so we're just going to assume that the facilities are either low stocked or even out of stock. So you assume no stock on hand at the service delivery point level, and you will compensate for that. You'll add that back into your procurement quantities. So you're trying to guess and gauge what do we think is going on at the lower levels, agree on that assumption, and then move forward with that assumption. Barbara, I don't know if you want to add to that, but why don't you want to go ahead and look at the next two questions?
Yes, I'll look at the next question. So the next question says, who should be involved in the quantification process? And this is a great question because it takes a team to do this work. Usually you have a combination of people, the people that are most familiar with the procurement process of your program or your organization. Someone who's involved with the data capture for the program, that has access to LMIS data, stock on hand data and consumption data. People that know about, you want to have service people as well, obviously, the health program folks as well as the logistics folks involved working together, because if there's any changes in program policy, who the target population is going to be, or any changes in the medicines and medical equipment that will be used, the program people often have that information. So it really is a team, and you may involve people from field, farther down in the pipeline and people at a more higher level in the country level pipeline as well. So you want to form a team, and ideally that team can do the quantification, also be involved in that routine review of the pipeline as the shipments are arriving, and can help make decisions as to, delaying shipments or increasing quantities or promoting shipments or, reallocating across, so that there can be decisions. It'll be that team that has created the assumptions and is most familiar with the data that they use. One thing that's important is, whenever you're doing a quantification, when this team is doing the quantification, is to document what you did, document your assumptions, so that when you do go back from 6 months or 3 months or whenever you're going to do your routine reviews, you remember, you can understand what the assumptions were in the data that was used. The next question is, can we do forecasting in emergency without any prior consumption data? And yes, you can. And we covered this in our previous webinars, but if you don't have consumption data, and many times in an emergency setting, you don't, because you have new populations coming in, internally displaced people, you don't have data that would represent their service needs. So oftentimes we use demographic data about the population, morbidity data, if there is anything available for that, surveillance kinds of morbidity data. But often it's the demographic data that's going to drive the initial forecast in the acute phase of the emergency, because it's easier to get though it's not actually easy, but it's easier to get the data on the population and make some assumptions about age groups, gender cohorts, and things like that in the population. So.
Okay, great. And I see a couple more questions have come in, and we still have a few minutes, so let's try to hit those. Barbara, I think you had talked about the expiry date and planning.
Mm-hmm.
You want to take that question?
So yeah, so if you have product, so this question is when the commodity is drugs, how to take expiry date into consideration in forecasting. It's actually not so much in the forecasting process, but more in the supply planning process. You really consider the expiration date. So the forecast is really, remember, our prediction of total commodity needs. What are we going to actually put in the hands of clients in the future? But the expiration comes up when we're doing the supply planning, and say we have stock sitting at a more central location that is not yet been distributed to the service delivery points, and we know how much is being drawn off of the centralized stock by those service delivery points. So what is the average monthly consumption of those service delivery points? And we see that the stock that we have at the higher level is maybe in excess, and therefore we can calculate, actually, based on our current average monthly consumption, if that stock may expire before it is distributed to those lower levels. Now you can try to increase consumption and use that stock before it expires, but if that's not possible, you have to take into consideration that quantity that will expire in advance of use when you're doing your supply planning, because that product will expire before it will ever be distributed. So we have to count it as a loss when we're doing our total commodity requirements estimate.
Perfect. Thanks very much, Barbara. There's another question, which is for buffer stock. Is there a golden rule to what percent to use? Wouldn't that be nice if there was?
Yeah.
There is no golden rule for buffer stock, but a general comment that we can make about buffer stock is, remember, what's the purpose of buffer stock? It's to account for unexpected things that come up in your supply chain. So generally, the rule of thumb would be, or the golden rule would be, if you have more uncertainty in your system, maybe it's a new system, maybe there's so many challenges that you're facing, you've had supply chain problems in the past. In that case, you want to increase your buffer stock levels. If your system is running so smooth and you rarely have problems, then you can get by with lower buffer stock levels. So the rule of thumb, or the golden rule, is not a specific percentage, but it's the guidelines that you can use to determine in our system, do we need more or less buffer stock? And it would be applicable at each level in the system. You want to add to that, Barbara?
Yeah, I was just going to add that, some of that buffer stock, when we're talking about buffer stock by level in the system, we generally start off by saying, if you're being resupplied, say, every quarter, then your buffer stock should be at least half of that quarter, so 1.5 months as your buffer stock level. And we talk about buffer stock in the same way we talk about stock status. We talk about it in terms of how many months of stock should you have as buffer. And so we would start off with that, with our different max min levels, as including a buffer stock at each level. And therefore there is a total buffer stock when you add your total maxes, as Greg showed you in the supply planning process. But as he said, it can vary. If your system has a lot of uncertainty, you may make that bigger. If it becomes more secure, then you may be able to reduce your buffer stock. But that really brings up the point of making it important to monitor your stock status as over, every month or as you get new data, so that you understand, and maybe you need to increase that buffer stock if you're seeing really low stocks or even stockouts. Hopefully we don't see too many of those.
Okay, great. Thanks very much. I think a last question, because we're just running out of time. Are you going to have certificates after the sessions? And the answer is yes. You'll get one certificate if you've attended or viewed online the webinar recording for the 3 parts of the quantification webinars. And there will be another certificate if you attend all of the webinars in this short series. Likely it'll be 5, possibly 6. But yeah, there'll be certificates, and you'll get some follow-up information about the certificates in the follow-up email from this webinar. So I think we've run out of time. We appreciate everyone sticking with us the whole hour and a little bit more. And we hope again that this has been useful. And we thank you again very much for participating and for attending. And we will look forward to seeing you in a future webinar.
And thank you, everyone. And I would just want to add that, just remind you, we will be sending a follow-up email with the resources for this webinar and the links to the part 1 and part 2 recordings and more information about the certificates. So thanks again, and for all your important work and for sticking with us throughout this hour.
Great. Thanks very much, everyone, and have a great rest of your day or evening or wherever your time zone is. Thanks again.